As a doctor, I see TB patient is suffering and dying. At the same time, there is diagnosis tool, there's effective treatment, and the TB patient cannot access that. It doesn't make sense to me.
Despite being a preventable and curable disease, globally 1.5 million people die from tuberculosis every year. This makes TB the world's second most infectious killer after COVID. Dr. Tuan is part of a research team from Vietnam and Australia. They have been working with local researchers since 2009 across 135 clinics, testing ways of stopping this disease in countries like Vietnam, where the burden of TB is high. Here, 100,000 people are found to have TB every year, while a further 50,000 remain undiagnosed, often continuing to spread the infection.
I think the most important work that UNCOP have done so far is to provide evidence that you have to screen TB in the community. Screening among high-risk population is not enough to bring the epidemic down.
Armed with a new technology that can detect the TB bacteria from a sputum sample, the team went door to door in Ca Mau, a rural province in Vietnam's south. They screened 50,000 adults across 60 villages annually for 4 years, and when cases were found, they provided effective treatment.
In the villages that we'd been regularly screening for 4 years, the prevalence of TB was nearly 50% lower than it was in the villages that we screened for the first time. So we showed that we could substantially reduce the number of people with TB in the population by regularly screening.
In another study, we showed that screening household members of patients with tuberculosis more than doubled the detection rate of TB.
I think this is why footpaths were invented. How many households would it take in a day for one team, do you think?
20 to 30.
Yeah, so that's each household has maybe 4 or 5 people.
As a result, active case finding is now used widely in Vietnam. And the World Health Organization has incorporated this approach into their global guidelines for managing TB, saving thousands of lives. But the team did not stop there.
We're now working to screen the general population for TB infection before a person becomes sick. And so we'll be screening around 100,000 people in a rural community in Vietnam to try and treat them for preventing tuberculosis. We expect to reduce the prevalence of tuberculosis by 75% over 4 years.
TB has been in Vietnam for many years and we haven't been able to control it. A lot of people died of TB. Every year around 10 to 12,000 people. In addition to that, there is a new risk.
Once tuberculosis becomes resistant to the most effective antibiotics, it becomes much more difficult to treat. Drug-resistant TB is common in many countries, including Vietnam.
Vietnam is a hot spot for drug-resistant TB. People who have drug-resistant TB require longer and more toxic treatments, which can be very difficult for them. We're working with local partners in Vietnam to develop new methods of preventing drug-resistant TB, which will be important for patients not just in Vietnam, but also around the world.
The team is trialling shorter treatment regimes, as well as a new digital technology. This involves using smartphones and communication between doctors and patients. In this way, side effects can be identified early, while patients are supported to manage their symptoms and to take their medication on time.
Thì hàng ngày uống thuốc thì nó say thuốc, mệt lắm. Uống vào nó say nằm từ sáng đến tối, không muốn, có nghĩa là nó mệt kinh khủng luôn ấy. Nó mệt, nó nôn nao nữa. Xong lúc đấy thì cảm giác như là không muốn điều trị nữa, lúc đấy chỉ muốn là thôi bỏ để chết. Nên các bạn nói chuyện thì mình chia sẻ với các bạn ấy một hồi là tự nhiên lúc đấy nó sảng khoái lắm. Xong rồi mình cảm thấy như là có người đứng cạnh bên mình để coi như là hỗ trợ, coi như là động viên mình uống thuốc ấy.
Thay đổi lớn nhất mà đối với Viện Khoa UNCOP đóng góp cho Việt Nam đấy, nó nằm trong 4 cái đổi mới nếu như chúng ta muốn chấm dứt bệnh lao. Đổi mới thứ nhất là đổi mới về tư duy, cái thứ hai là đổi mới về công nghệ, cái thứ ba là đổi mới về tiếp cận, và cái tư là đổi mới về đầu tư. Mục tiêu cuối cùng đấy chính là chấm dứt bệnh lao. Đấy chính là làm cho cái chết của hàng chục ngàn người sẽ không xảy ra. Tức là tránh đi cái chết của hàng chục ngàn người và làm cho hàng trăm ngàn gia đình hạnh phúc.